I like a fight is because I saw big pharma is just has this huge suppressive agenda to keep people sick.
Dr. Jarrad Martin, how did you find Carnivore?
Well, I was prepared for you to ask that question. So honestly, I stumbled across Carnivore on YouTube, like many people, and I have to give credit where it's due. It was Lily Kane that I first saw some of her videos, and I was thinking this girl's crazy. And then it just I kept looking from then on and more videos. So that's how I got started with it. Later on, I got into Mikhaila Peterson, and I'll talk about that a little bit. But that's where I found it, was looking on YouTube. I was already in health at the time, very deep into health and nutrition and diets and chiropractic and all of that. But I still was eating what I thought was a healthy diet, and from there I learned a lot. So I'm glad that I went down that rabbit hole for sure. So just to kind of start from the beginning, I worked 8 years in a pharmacy, really just witnessing an industry where they just treat symptoms and never get to the cause. Nobody ever got healthier, in the pharmacy, right? So it's just the medication, and we kind of all know that now. And then, so that led me to chiropractic. Chiropractic is the largest drugless profession, and I was kind of done with that. I had already been reading about nutrition books. I've gone through all of the diet books, everything from vegan to raw to fruitarian to paleo to eat right to your blood type. I kind of started reading all of these books, and so I was a chiropractor in Dallas, Texas for 10 years, and in 10 years. I got a lot of people out of pain. I mean, chiropractic is amazing. I have the most amazing stories, patients that were suicidal, patients that came off of their pain pills. And so chiropractic is amazing. But there is still a part of it that's this one big gaping hole. And that's what people are eating. Because what I experienced was, as great as chiropractic is, and as much as it helps people, they still had to come back a lot, and that's where I just really started to realize you really have to take into consideration, it's the biggest gaping hole. It's the biggest problem with people's health is what they're eating, what they're putting in their body, what's causing inflammation. So for me, watching Mikhaila Peterson and her talk about how she had the two joint replacements, an ankle replacement and a hip replacement by the time when she was 20 years old, and she had the juvenile onset arthritis. Well, that really piqued my interest because, it got her out of pain. And then she talked about all the other things, and that was amazing to hear. So this is kind of the path that I've been going on. So meanwhile, I'm practicing chiropractic, and I've got some of my own issues, and I ended up going on a after watching a lot of these videos. There's just one night I remember eating a steak, and I just didn't put anything with it, and then I just never stopped after that. I just kept going on and kind of went deeper. I tried some of the supplements, the liver supplements, all of that. I did better without them, and I noticed it was the biggest changes that I'd ever felt in my own body from making a change with my health. And so there's kind of a big three. So I used to have, and I'm sure that you've had some viewers, hopefully, that have had the same experience, but I had indigestion, a heartburn for so many years, and I tried so many different things for it, but it was so bad that I would wake up in the middle of the night sometimes to vomiting in my mouth, and I have to run to the bathroom and spit it out and wash my mouth out. And it would get really bad at night when I would lay down. And after I went carnivore, it took probably maybe 2 or 3 weeks before that indigestion went away, and it has never come back. Never, even if I slip up on the diet and I go visit Taiwan with my wife, and we go to a night market where somebody's been cooking something for 80 years, and so I say, okay, I'll try this. I'm still not getting the the indigestion that I had, and I really now I really understand that my stomach acid was probably more alkaline than it should be. And now that it's more acidic, everything digests better. And I went through a whole gut healing experience with it. Everything that, everybody talks about with their digestion, the whole, I experienced like the whole diarrhea at the beginning, just from, taking in all that fat. And really it's like your liver and your gallbladder getting used to that amount of fat again. And, yeah, so that was a huge part of it was the indigestion, and right about around this time, this is where I'm really starting to head towards gut health, so but just to finish up, so my sleep improved, but it was in such a weird way. So before Carnivore, when I would go to sleep, if I woke up in the middle of the night, I could tell you almost exactly what time it is. Like if I woke up and say it's around 2:00 and I look at the clock and it's 2:10. When I did Carnivore, I started passing out to where I had no idea. It was like total unconsciousness. And I would wake up in the morning around the time I was supposed to get up. But I realized it's almost like there was a restlessness to my sleep before, to where I was tracking time and things like that. To where when I went Carnivore, when I sleep, I have to set an alarm. If I took a nap, then I would have to set an alarm. And when I pass out, I would pass out. And so I just feel like the sleep was so much deeper, and that along with healing the gut it just helps so much. There's another thing that was a huge improvement was I had, and this is kind of embarrassing as a chiropractor, I had this hip pain, and it was just when I would lift my leg, and it was a problem with my hip flexors or the actual hip joint. But every day when I would put my pants on in the morning, I would lift my left leg and I would feel that pain, and it was like this sharp pain in it, and I would have to kind of push through it. And I've been adjusted and all those things, but when I went Carnivore, that went away, and it's never come back again, that's a huge thing. Along the same lines is just like, Anthony Chaffee talks about, I would go to the gym and work out, and I've always, my whole life, whenever I went to the gym and worked out, I would be sore after. Well, last year I actually maxed out my bench when I was doing Carnivore, and I still had that same experience where I was not sore after. The day after I wasn't sore. The day after that I wasn't sore. And that was another huge realization that I had. I used to have really tight shoulders, and probably it's from a lot of adjusting and things like that. But if I wanted to put my hands behind my back, I'd kind of have to stretch, to get my hands and touch my hands behind my back. And when I was doing Carnivore, I just noticed I could just throw my hands behind my back very easily. And I realized how much inflammation had been in my shoulders and in my joints for all of these years. Because being sore after working out and having joints that are stiff, and with the inflammation, it's like everything's packed in, right? So you get rid of that inflammation, and I was able to move my joints through a better full range of motion. And in chiropractic, I know what makes a joint healthy is full range of motion. So that was pretty easy for me to keep going with Carnivore and keep kind of searching deeper and deeper. So that led me to really what I wanted to do, and what my passion was, even back in pharmacy when I was reading all the diets, is nutrition. And so after having such a great experience with Carnivore, I wanted to start a functional medicine practice and put the first foot forward as the carnivore and animal-based diet, and then be able to do gut testing and be able to actually help people through this process of, okay, where do I start? And how can we test blood, or how can we even test your gut and see what's going on inside your gut? We can test for, I test for it's parasites, viruses, good bacteria, bad bacteria, overgrowth, infections, different things, because the gut is where it all starts. And even I think it's the American Diabetic Association says that they even acknowledge that leaky gut, having gut dysbiosis or having your gut not right, can actually lead is what the beginning of starting diabetes. And so, just not to lose my place, I really wanted to start the functional medicine and be able to show people, because the truth is even though this is an ancestral and primal diet, there's still not a lot of research going about, when, just for instance, when I went through my functional medicine training, I mean, I have to wade through this mountain of fiber, and fiber for the gut, microbiome, and there's so many studies on it and all of this, but there's not a lot of studies on if we take fiber out. And so it is a challenge to be able to find the right information and keep up on. There's a group in Kansas right now. They found that the good bacteria, basically healthy bacteria in your gut, it feeds on protein and fats, and then the bad bacteria feeds on carbs, and it's still, there's a lot that needs to be done, but that's one of the reasons why I wanted to do the testing and be able to show a before and after and see what's actually happening. So it's either test the blood and do different blood tests, and then put somebody on carnivore or animal based as much as they will for a period of time, and then check those blood markers after, or redo their gut map and see what needs to be done from there. And sometimes people do have a hidden infection. They have hormone imbalances. They've got metabolic disorders that they might need some help with along the way, or maybe they just need somebody to talk to and somebody to help them along the way with doing a carnivore diet. But I do believe that's the biggest help, is to put somebody on that first, do that, use it either as a therapeutic diet where they're doing it for a certain period of time, and then if they want to, they could start adding some things in, but at least they'll know, well, when I add this in, I have an inflammatory response. I feel like crap. My joints get stiff, all of that.
So when you do introduce this to people, and you say, well, I guess you're setting it up as a bit of an elimination diet so that they'll be able to then look at introducing things in the future. But what is people's reaction generally?
The trend is that I've found that people aren't against it. There's nobody that just says no, but it takes a conversation. I have that conversation with them where I go and talk about all of the things that Dr. Chaffee talks about with this is how we evolved on meat. We became apex predators, and I'm a common sense guy. So if carnivore makes more sense than anything else has made sense. And I think if we just stick with the common sense, because we can really get into the cholesterol conversation, the fiber conversation, all of that, and I think we should have that conversation. But there's also a common sense part of it that I think that people really get, and that's what it took for me, because I was even vegan for a period of time and really thought I was doing the right thing, and I could argue veganism to somebody, and I could also argue carnivore for somebody, because, and this is where it really comes to my big mission, is that I am I like a fight, and that's why I went into chiropractic in the first place, is because I saw big pharma is just has this huge suppressive agenda to keep people sick. And that's what I believe. It's just you really, there's too much medication. There's so much unnecessary medication. There's no true healing. And chiropractic, like I said, biggest drugless profession, and I kind of I helped people get off of their within my scope of practice, help them not have to take their pain medications and things like that. Well, it all kind of starts with big food, because big food is and a lot of that agenda is what gets people sick in the first place. So they end up at the doctor's office needing pharmaceuticals. So I've kind of switched my target from, I want to just do as much as I can to keep people off medications, to now I want to keep people from eating all of that stuff that's in the middle of the grocery store that is, got a really high profit margin, that they can put whatever they want on the box, and kids are going to walk by and say, oh my gosh, I want that, and that's what it's designed for. It's genetically engineered for us to keep wanting more and to not be full. And that's another thing I experienced with carnivore, is actually what being full is, really, really feels like. So that's kind of my mission now, and it's not about being perfect, but what I can't stand is being a pawn in somebody else's sick game. And that's what I want to get through to my patients, is by the time that they're done with the treatment plan for me, I want them to be self-determined in what and have stable information, stable data that they can think with, and they can use their common sense, because there's so much confusion thrown in with the, studies from big pharma and funded by big pharma and studies funded by big food. And Dr. Chaffee talks about the Seventh Day Adventists and those agendas and things like that. So what I want to do is provide an environment like where somebody can pluck out of the sea of just bad information and pluck out a piece of information and go, this is true, and that's something they can start with. And then and then them being able to expand from there and be able to think with it for themselves and decide, does this make sense for me? Do I want to do this? And it should. And if it doesn't, then they've got to either get more information, or you've got to be able to make their own decisions on it.
Well, what is it that separates the I guess the thinking model, or something like that, between people who are in the chiropractic profession versus other doctors? So I've interviewed quite a few chiropractors, and
Mm-hmm.
I've always feel that the message comes across. We want to heal the patient. We want the patient to get better. Like, if the patient's coming to us every week, that's kind of not that's not the goal, right? The goal is to actually get them to a point where they don't need to come to us every week. Whereas for other doctors, it seems to almost be the opposite. We need them reliant on us to come in and get their prescriptions filled or consult with us about some other problem. Why does that difference exist?
It comes from the foundation of the philosophy of chiropractic versus and those kind of alternative professions versus medical. And so I think it's all in the education, right? I mean, we kind of all know that medical doctors aren't taught nutrition, in school. They're taught, what medication, what surgery, that kind of thing. And not to knock medical doctors, because most of them are amazing people, but a lot of them are stuck in a system, in a standard of care system. And I think it's just kind of bred that way. And when you look at chiropractic, you have to be a bit of an against the grain kind of person to become a chiropractor. And I feel like chiropractors are like those kids that you see that say, yeah, but why? Yeah, but why? Yeah, but why? Trying to get to the root cause. And like I said, I'm a very common sense person, and so I have that same question of yeah, but why are people's joints breaking down? Why did people's spines degenerate? Why did these, and why do other people's not? And so I think that it's just bred in from the very beginning. And I think it takes a certain kind of person to become a chiropractor, because like I said, it is against the grain. And so I think it just got, yeah, to answer your question, I think it just comes down to education, right? And who's funding that education, where the agendas are.
It's almost like the system like the mainstream system is designed to breed the critical thinking out of people, whereas, as you say, the but why people, I mean, the system there is more about critical thinking.
Yeah, I mean, if you take into consideration as a medical doctor, you've gone through all the school, you've got all this debt, and then you've got a standard of care, you've got a certain period of amount of time, you still have to pay rent, you still have to, you're still, medical doctors, there's what, how many, last time I looked was like $3.3 trillion of healthcare costs in the United States, and that money is not going to the medical doctors, to the chiropractors. It's, medical doctors, it's gotten harder and harder. This is why it's one of the highest suicide rates in healthcare, and I think it comes from the people that truly want to help people, and then they get stuck in a system to where if somebody comes in with high blood pressure, you've got to prescribe them a high blood pressure medication, or you could open yourself up to being in trouble. They get I believe they get calls if they are not prescribing the normal amount of it, medication and things like that. So I think they're just people that are in a system and they're trying to make it work, and a lot of them, I think it's so strong that a lot of them don't have the time or the bandwidth left to say, okay, I'm gonna sit and talk with every patient, and I'm gonna convince them, of how they need to change their lifestyle. There's I mean, what is it? Every like third commercial is a drug commercial in the United States. I mean, people are coming into medical doctors and they have an idea of what they want. I've got restless leg syndrome. I need this medication. What do you think about this? And I think that a lot of the times the medical doctors are probably, well, thinking, well, if you're not going to listen to me, then yeah, here, take your medication. And so again, I think that they're a lot of very good people and stuck in a system that really needs to change from. And I think it's from the bottom up. And really, one of the reasons I went into functional medicine is that I believe that functional medicine is an answer to that. I'm able to spend the time, on a phone call to talk to my patients and go through the whole arc of the carnivore diet and animal-based diet, and actually red meat is healthy for you, and that whole conversation, I can actually stay with them on that, and I can answer their questions, and I can go long if I want, and I'm not, I don't have, I just, it's set up in a different way to where I can spend that time and I can really, focus on helping people in that way, because that's the end result. We need people who are self-determined enough about their health to where they can make the right decisions, and then they won't need us so much. You mentioned people having to come back and come back. There's a neurological aspect of chiropractic that I do believe people need. After a treatment plan, they need some kind of maintenance care. There's a lady named she's Dr. Heidi Havoc that's out of New Zealand, and she's a neurophysiologist as well as a chiropractor. She's doing the studies. She's doing all the studies that chiropractors don't want to just don't want to do. Like I said, chiropractors are a bit against the grain people, and I think that we have in our clinics, we see clinical evidence every day of people getting better, to where there's not as many chiropractic studies. Anyway, she's doing them, and she's finding and starting to back up everything that chiropractors have been saying over the years. Even the founding chiropractors, they may not have said it in the exact specific way, but they had the idea and they were correct as well. And so she's actually doing studies whenever they adjust somebody, if she hooks them all up, and what lights up the most in their body is actually their brain, all the way into their frontal lobes. So when they adjust somebody and you adjust a joint, there's mechanoreceptors and proprioceptors, just receptors inside the joint that fire information to the brain. And so whenever we adjust, we move a joint in an adjustment, especially a joint that is stuck or not moving properly, then it will fire the information to the brain, and the brain can better manage the body. And so that's kind of what the research she's doing. And since it's going into the frontal lobes, they're even now they're doing studies. I think she's doing studies in Pakistan with kids, and they're adjusting some and not adjusting the others, and seeing how differently they learn and things like that. So there's more studies coming out about that. So I do believe chiropractic is one of the professions where you do need some kind of maintenance. There's benefits to that. But what I was seeing in my practice was that people were still having a lot of health problems, and it wasn't getting them. Chiropractic could only take them so far if they're leaving my office and going and eating McDonald's. And again, all comes back to the gut, to where if your gut is messed up, that's just where everything else can spawn from that. So you probably heard the gut brain connection, right? And so there's actually a gut lung connection. And then, how long is it going to be before it's like a gut everything connection? I mean, it's, again, common sense. If if we have holes in our gut that are our gut is just like a hose, and our food goes, and nothing's supposed to get in our body, and it's kind of like, I don't know, border security, which is relevant in America right now. But if you have a wide open border, anybody can get in. And so if you have holes in your gut, it's not locked down tight. Well, then there's things that are going to get in your gut that aren't, or into your body, that aren't supposed to be there. So if you think of like a garden hose with water spouting out of, with a hole in it and water spouting out, well, that's kind of what happens with your body. But your digestive system is a hose. Instead of the water leaking out onto the lawn, it's actually toxins that are leaking inside your body, because that hose is inside your body. So stuff gets in, and this leads to the problems with other systems in the body. So if you can get the gut healing properly, then that's the first things first, and then you can address all the other things. But I always start with gut health first, because if that's not right, I do feel like, again, you're treating symptoms. You're just running around trying to treat some symptoms, and sometimes people need some of that in the beginning to be able to live their life. But if we're trying to get to the core reason, and that's why I went into functional medicine, and why I like carnivore and animal-based diets, because it's first things first. We got to heal the gut, and we got to stop eating the stuff that is causing these problems and causing these leaky guts, is what we call them, or dysbiosis, and that leads to other things.
So you're practicing in Melbourne, Australia now?
So I live in Melbourne because I came here. My wife and I just had a daughter 6 months ago, and uh, thank you. So yeah, so I moved to Melbourne, but I still practice in Texas. So I practice virtually, and right now I just practice in Texas. That may change, but right now I'm doing Texas, and I do that virtually because with chiropractic I always had to be there to put my hands on somebody, but I practice primarily in Texas, and then I also am working with a naturopath here in Melbourne, and that's over in Fern Tree Gully, and I'm doing some of the functional medicine and some body work and things with people here. Since I'm newer to Melbourne, there's still some different like credentials and things that I need to get before I fully, am situated in Australia. But so right now it's mostly Texas that I'm doing the work with.
Interesting, and it's really cool that you can continue that doing it remotely.
Time zone's a bit of a challenge sometimes, but other than that, as long as I can still, get my message across and everything, then yeah, I'm good. And I'm able to send the testing to people, because with the testing that I do, it comes in the mail. They can do it in the mail. It sends back to the lab, and then it sends me a report. So it makes things pretty easy. And then people can order, supplements, and it comes from the United States to them.
Oh, nice. Um, so on you personally, how long have you been doing carnivore now?
Probably about a year and a half, maybe a little longer. and had some coming off and coming back on just with all of the moving and all of that kind of thing. But yeah, probably about a year and a half.
Right. And what does your day-to-day menu look like?
I'm pretty simple. So I'm from Texas, where the steaks, the giant steaks, flow like wine. and and in Australia, I mean, you hear about beef in Australia, but the culture in Australia, I think, and we have Woolworths and Coles, Woolies and Coles, and they have, in Texas they have these giant ribeyes that you can buy, and I used to go to HEB and just load up on meat. But here they're a lot smaller portions and they're a lot thinner. So I actually have been just kind of getting by, and really what I need to do is go to Costco and just do it. Dr. Chaffee does, and just buy a big, slab of meat and throw it in the refrigerator and cut it up. But I do a lot of eggs and bacon for, I've really only made 2 meals a day. So usually somewhere around lunch, maybe a little before lunch, I do eggs and bacon, basically, or I put in some ground beef in there. And then for dinner, it's either ground beef, and then I'll do, I like making some of the, like the carnivore ranch with it's like sour cream and cream cheese, and so I can dip some things, use some sour cream, and but it's either ground beef, some ground beef with some ground pork. I definitely follow that, that the ruminant animals are the best to stick with. I think that beef is the best to stick with. Works the best for me. I don't do a lot of the organ meats. When I started, I ordered some of the beef liver supplements, and I started taking that. And I started actually having trouble with electrolytes and dehydration and things like that. So I came off of those, and when I just eat muscle meat, basically just steaks and ground beef, things like that, then I seem to do the best. And I don't really need, anything else. I don't need to really focus on electrolytes and things like that.
Right. And when it comes to bacon, the bacon in Australia is quite different to the bacon in the US, right?
Yeah, it's different. It's different. And when I go to the grocery stores here, there's a lot of things that are added in. So in America, it's like this land of options, and I could always find, say, bacon, just bacon without sugar. And here, if you go to like the regular grocery stores here, they just don't have as many options, and so some of the bacon may have some sugar added to it, and the sausages are going to have, things added to it and stuff. So that's why right now I'm keeping to, like, more of like the eggs and ground beef, and then I'll do steaks, lamb as well. Eat like lamb chops, lamb steaks, things like that.
So, like, how is your wife with this? Is your wife following along?
She is more on the keto side, and so she's from Taiwan, and so she's Asian. There's so many carbs in the Asian culture, and so she's slowly coming this direction, but she's more keto. So she'll get some of like the chopped up like broccoli and cauliflower, and make, the kind of a fried rice type thing with that, with some meat. But I personally, I think that it's too much fiber for her, is what I think is happening. So I think that she is slowly coming over this direction, you know. But so right now we just kind of manage it, and I usually kind of cook my meal, or she cooks it for me, and then she'll add something into the rest of it.
Right. Okay, got it. Um, so, Jared, how can people reach out to you? Do you have a website or social media or any way of getting in contact?
Yeah, I do. I have a website. It's primalwellnessfm.com. So it stands for primalwellnessfunctionalmedicine.com. And then it's the same on Instagram and Facebook. And yeah, those are my main ones. So, and that's just, it's primal underscore wellness underscore FM. But yeah, if you look up Primal Wellness FM, you should find me on it. So
Okay, fantastic. Well, I'll link to those in the show notes. Um, Jarrad, thank you so much for coming on and sharing your experience with us. I really appreciate your time.
Yeah, thank you so much for having me on. Thank you for everything that you do. I know that you're working hard to really get a lot of videos out and get a lot of this information out. And definitely some of your videos were some of the ones that I watched. So really appreciate that what you're doing is helping a lot of people.